Hello and welcome to the summer special broadcast of Risk Reduction, brought to you by Universal Family Connection. I'm your host, Jeffrey Jones, and today we're going to be diving into some themes. Our theme for right now is the summer of safety, healing, health, and hope in our communities. This program is about empowerment, education, and action. So today, along with my guests, we'll talk about HIV, maybe some hepatitis, COVID-19, monkeypox, and even more. Why are we talking about these? These are real issues that are affecting African-American neighborhoods especially. And today we're here to bring some clarity, hopefully some resources, some care, and some compassion. Today, I don't have my usual co-host, Lade. We're saying hello to Lade. She's out sick today and had a tragedy, actually. Hello, Lade. But today joining me are two amazing young women, Mania and Terrilynn from Nefuse Case Management, which is one of our trusted partners in the HIV services space. Nefuse, you'll hear more about, was founded by Gina Evans and just celebrated 5 years of extraordinary Black excellence in services. We had fun, food, the community came out, and we really enjoyed ourselves this year. So let's talk about what we mean when we say risk reduction. Some people call in and ask, what is risk reduction? At Universal Family Connection, we believe in empowering our community with information, services, and support to help reduce health risk. That includes providing access to confidential HIV and STI, which is sexually transmitted illnesses or sexually transmitted disease testing, linkages to care, hepatitis C, testing, education, treatment, and support. We also do education about the COVID-19, and because that's still around, we're still vaccinating for that, as well as monkeypox. So we believe that prevention starts with trust and knowledge. That's why I have these two amazing women with me today, so we can bring about trust and knowledge. And with our two agencies, we offer both of these. Let me share just a quick story. Recently, one of our clients came in for a test. They were hesitant, scared. They didn't know what to expect. We took them through the whole with compassion and support. We took them through the whole script. We walked them through it every step of the way, told them about their options and everything. Today, they are not only just living, they're thriving, and they have become one of our biggest advocates for others. Okay, so that's what we do at Universal Family Connection. Universal Family Connection is located at 1350 West 103rd Street in the Beverly area. We were founded over 45 years ago by Dr. Lorraine Broyles, and you'll hear more about us. Let's bring Mania in from Nefuse Case Management.
Hi, Jeffrey. Thanks for having me.
Thank you for being here. Can you tell us what inspired the creation of Nefuse and what brought you in?
So the model for our agency is bending over backwards to keep you healthy and in care. So Gina started Nefuse 5 years ago because she worked in many different facilities as a case manager, but she's seen how there was a lack of a hands-on approach with our clients. Okay. So she opened the agency in hopes of getting more personalized care to our clients. So, for example, we definitely do patient advocacy, where we escort the patient to their doctor's appointments, because some patients don't know what questions to ask. So we provide them that confidence, or we may even ask the questions for them just so they can get the answers that they deserve and or need.
Okay. And do you find that many clients don't know what to ask their doctor? They don't know how to interact with their physician?
Oh, absolutely. Because we even asked, when I do my monthly check-ins, I say, hey, do you need anything? Oh, no, I don't need anything. Well, then I ask, hey, well, how is rent going? How is housing going? How's your medications? Oh, I have to pay co-pays. Well, sir, I can absolutely help you with that. I can help you apply for ADAP, which is the medication program that IDPH offers to our clients to get their medications covered without co-pays.
Exactly. That's great. That's great. So sometimes they don't even know what they need until you kind of pull it out. That's what I love about Gina and you guys' program, the hands-on that you put into it. What other kind of services does Nephew provide for those living with or at risk for HIV?
Oh, we provide a lot of services. So for patients that are living with HIV, they're our main population for our caseload. So we definitely do home services. So we get a referral. We refer them to either if they have a personal person who would like to help them, or we assign them to a homemaker agency. So we check in monthly, every other month, to make sure that their home is clean. Not only that they're receiving the care and the respect that they deserve. Because your house may be clean, but if your worker is abusing you, that's not okay. So we always check for that. And then for people who are at risk with HIV, we have monthly events, Tuesday Night Tingle, first Tuesday, where we not only have vaccine clinic, but we also have your assistance with providing testing once a month on first Tuesday when you bring your wonderful testing van, and just to make sure that everyone is updating their status.
That's good. That's good. That's excellent. Now, we do know as providers, building trust, especially in the African American community, is critical. Due to his history of being misled in some of these. How do you connect with individuals who may feel forgotten or judged?
Well, checking in is always the most important part. So when I do my monthly calls, I have clients that thank me genuinely from their hearts that I'm checking in on them. And that makes me feel a bit happy and a bit sad that they're not getting that communication, whether it's from family, friends, or anybody. Some people just stay at home and not have any social interaction. So I do my best to make sure that they're not forgotten. We make sure we call them on their birthdays every year. And we also provide, this is something only Nephews does, we don't have to do, but we provide gift cards for their birthdays and many other things just to make sure that they don't feel forgotten and that we actually care.
Oh, that's good. That's good. So you guys do some wonderful work.
Exactly.
Let me ask you this. Can you share a powerful moment or breakthrough story that you've experienced doing this work?
Let's see, I have multiple stories, but I can give you one. So it was a new referral came in, and Gina assigned me to her case as I was just starting as a case manager last year. So she came to me around February. So she was like, hey, I need help at home. This is my first time having home services. So I'm like, okay, do you have someone in mind to work for you? She was like, no, but I have a couple of people who I can ask. So I'm like, okay, just get back to me when you can, once you contact that person. And then unfortunately, I got a call back saying that, hey, I told them my status and they no longer wanted to communicate with me. Wow. So, yeah, it was very sad. So I had to tell her, I'm like, hey, you don't need to tell anyone your status to get a worker. That person does not have to know at all. You could just ask them, hey, I need help at home. Because that was her biggest worry. She was ready to quit the program entirely because she thought she had to explain her status to people just to get help at home. But I definitely had to tell her that, hey, in Illinois, you do not have to share your status with anyone. Especially if you're just trying to receive help. And that resonated with her, and I'm glad that she's still one of our clients to this day, and that I was able to push her forward to continue with the program.
That's why it's so important that we share information, because some of our clients are unaware that they don't have to share this status. They're unaware of what they deserve. You talked about the AIDS Drug Assistance Program, which is ADAP, where they actually pay for your medications. So some of the clients don't even know about that. So it's good that they visit our services and they can actually learn about what they have available to them. So that's great. Finally, how has this partnership between us, and I really enjoy working with Gina and you guys, you ladies, how has it made an impact in our communities or where you're located?
Well, I think it's great, not only because we can't offer testing just with nephews. So I'm grateful. I'm eternally grateful that we actually partnered up with you, Mr. Jeffrey, at Universal Family Connections, because we can, not only do we have access to testing, we can both use our connections to outreach more versus just the south side or just the west side or just the southwest side. We can reach an entire, more than just those sides of the city. We can reach a bigger population. So not only that, you always avail yourself not to assist us as well. So I'm always grateful for that partnership.
And I'm grateful for the partnership as well, because there isn't anybody in the city of Chicago that Gina doesn't know. So I meet so many new people. As a matter of fact, the other day we had National HIV Testing Day, and I was there at Walgreens, and somebody that knew Nefuse and Gina gave me their business card and talked to me. So it's just like you meet so many people through Gina, and she's just got this outgoing personality. So it's really impacted the way that I approach HIV services as well. Now let's talk to Terrilynn. How are you today?
I'm okay. How are you?
Good. Let's welcome Terrilynn. Terrilynn, tell us about your role and yourself, your day-to-day work there at Nefuse.
Well, I'm the health navigator at Nefuse, and like Mania mentioned earlier, we are a different type of case management company. So I assist personally with getting patients to their appointments, scheduling Ubers, making sure that they get their medications, and kind of doing the referring part. I'm not so much a case manager, but I'm the health part, sort of, kind of. If they go to an appointment and they find something out in an appointment that they're not sure of, they can get back to me and I can kind of give them an understanding about it.
Okay.
I can also, advocate for them a little bit better than for themselves, because again, like Mania mentioned, with this population of people, a lot of times they don't feel comfortable with even talking to their providers. And we do a good job of, building relationships with our patients and our clients so that they're comfortable to talk to us and we can advocate for them.
Okay, that's awesome. Let me ask this. Why is culturally responsive care so important in what you do? Why is it culturally responsive care important in what we do?
I think because it's affecting our community, right? And we see these PrEP commercials, and there's nobody really on the commercials that look like me or my brother can identify with. So I think it helps knowing someone that's like me, knowledgeable, that can help me, receive the care that I'm supposed to get. And it breaks down so many barriers, the communication barrier of, just being able to talk about what I have going on.
And that is very important, because I think other people might know it from the book, so to speak.
Yes.
But they really don't know some of the day-to-day activity that might go on in an African-American household. Some of the stigma that we deal with might be different from the stigma that a white household might deal with. So it's so important that we look at it from a cultural vantage point. We need to see not just your diagnosis, but we need to see your color, we need to see your social, economic background, we need to see things about you that other groups may not think is very important. So I think that's really good. What are some of the biggest myths or misconceptions people still believe about HIV and hepatitis and COVID even to this day?
I would say for HIV is that you're going to die. That's not true. You can live a great life, a thriving life. You are able to continue on with, day-to-day activities. As far as Hep C, a lot of people think that you can look at someone and see if they have Hep C. That's not always the case.
Yes,
when you can look at someone and tell it, that means it's too far gone, right? So just regularly getting tested. As far as the COVID vaccine, so many. That it's a microchip, that it has pork in it. Yeah, we've heard them all.
And that really is, I don't know if to call it ignorance or just lack of understanding, but they are so it continues to feed the stigma that's in our community. So that people don't want to get tested. Because I do testing for the longest, I hear so many excuses why people won't get tested, and it is due to these myths that are still in our community. That's why we have this program once a month, so we can talk to people about the stigma, and we can talk to people about the myths that exist in the HIV space. Let me ask this. How do you support someone who's newly diagnosed or afraid to get tested? How do you do that?
I build a rapport with any person that I come in contact with in this work, because it allows them to be able to trust me, right? And then I provide them with resources, right? So if you are, I can, give you the resources to help you get your medication, or, get to a doctor's appointment, or even get testing done, right? Because we have connections with you. And yeah, it's just mainly just providing them with the resources, just letting them know that we're here for them all around, right?
Okay, sounds good. What can each of us do to help reduce stigma and promote healing in our communities? What do you think?
I think is spreading the truth, right? HIV isn't a death sentence, okay? You can get tested for it. The testing doesn't hurt. You are able to live a thriving life. I think a lot of people are afraid to get tested because of what the results might be. And yeah, that's really it. I just think people are scared because of what they see on social media, right? And they just don't think that they can get it.
Exactly. And that's why it's important, and I'll keep reiterating that it's important to get the information so that you can reduce the fear of getting tested. Because once you get tested, you can get your treatment. We give you referrals, linkage to care, and we walk you through it, just like Mania and Terrilynn talked about. We don't just send you to a provider. No, we take you by the hand, walk you through it, make sure that everything you need and everything that you that's available to you comes to you. And we don't care how long it takes and what we have to do, but we'll get it done. So please come in, get tested, update your status. You need to know your status, and you need to know that you can live a long, healthy life with HIV. HIV is not a death sentence. Hepatitis is not a death sentence. They have all types of highly effective treatment now that you can get on, and you don't have to be rich like Magic Johnson. That's one of the myths that
that's another thing too. You have to have money.
You have to have money. And Mania talked about the ADAP program. They pay for your medication. So even though the medication is expensive, we have a service here in Illinois that they will actually pay for your medication. So avail yourself of the information. At least get yourself tested, know your status, and then and only then can you get the treatment. You won't know that you have HIV or you don't have HIV unless you get tested. Okay, let's open it up for some reflections together. When you think about Black excellence in public health, what does that mean to you, either Mania or Terrilynn?
I think that's all of Black people in good health. And by good health, I don't mean super healthy. I just think that they're aware of what they have going on and they're making the lifestyle changes, right? Because that's one of the main things. We can change our lifestyle.
What about you, Black excellence in healthcare?
Well, considering the fact that, African American people have a high mortality rate than other, groups of people, I think Black excellence, especially in public health, is not only being comfortable speaking with your doctor, but we receiving a fair use of health care as everyone else. So I know medical insurance plays a big part in that, but regardless, we should still be able to speak to provider and get the best kind of help as we can.
Wow, that's it. That's important. Like I said, that's why I like Nefuse so much. And even we had just another agency recently opened its doors called Onyx with Dr. Maya Green. And you guys do so much excellent work around our people, even if they can't pay, even if they are resistant to the care. So it's good to have that Black excellence. How do summer outreach events like block parties, health fairs, and festivals help us meet people where they are?
Well, considering that Nefuse just had their 5th block party celebrating the 5th anniversary on Nefuse that occurred on June 14th, I think we had a great turnout for people to come get a feel of not only what Nefuse is, but we had you was there as well for testing.
Mm-hmm.
We had the hub from AFC, and then we also had CCHE.
And the Vision Van, too.
Yep, and the Vision Van as well, just to not only promote healthcare, but for people to just stay educated and to learn to protect themselves and to also come back should they need further resources.
Okay, looking ahead, how do you envision this work evolving in the next 5 years?
I think it's going to get even better. I think we're going to reach more people and be able to provide even more services to those who need it.
Okay, and finally, what's one word that keeps you going every day? What's one word keeps you going every day?
I'll say perseverance, because it's not an easy job, but as long as you stay strong and make sure to take care of yourself, I feel like you can go down a long road with it.
Okay.
And for me, I would say impact.
Impact.
I think I try to make an impression on everyone that I come in contact with, impact their life in some type of way. So that just keeps me, going.
Okay. Well, Terrilynn and Mania, thank you both from the bottom of my heart. Thank you for being here. Thank you for bringing healing and health and hope to our communities. It's my pleasure to work alongside of you and Gina and Nefuse. To our viewers, Universal Family Connection is here for you. Get tested, get vaccinated, ask the questions. Make this a really good, safe summer. If you want to visit us, we're at universalfamilyconnection.org. It's UFCINC.org, because when our community is healthy, our future is powerful. Let me say that again. Because when our community is healthy, our future is powerful. We thank you for tuning in. You can join us again. Until next time, stay safe, stay whole, and you can tune in next first Wednesday of August, and we'll see you then. Thank you.